It can be black salt, pink salt or white salt, the sodium content is the same. Any person who is going to embark upon 150 minutes of physical activity per day is going to take care of every organ system.
So that gets me to high protein diet. Do you think that has an effect on overall kidney function?
These kidneys don't require any further external deterging agents to flush it. My professor used to say that complete urine examination is poor man's renal biopsy.
So welcome to the program, doctor, and it's a pleasure to have you.
Thank you.
So every doctor has a story behind their white coat. So tell us about how your medical journey began and how is it going?
That's a wonderful question to start with. Basically, my father was a teacher and he was an asthmatic. So he was longing that his son should become a pulmonologist. So basically, I entered medical profession to become a pulmonologist. Once I entered medical profession, in my third year MBBS, I felt so fascinated by looking at the kidney structure, how kidneys function. There used to be my professor by name Krishnamacharlu garu. He was a wonderful pathologist. He told me one day, any person, any MBBS student who can master kidney anatomy and kidney pathology can master any specialty in the medical profession. I felt it both puzzling and fascinating. Like that, I developed passion, interest and morbid passion into kidney sciences. I did not become a pulmonologist as per wishes of my father, but I became a nephrologist. That's why my calling was totally different.
I mean, that's so true, right? Because we take our kidney health for granted and it is so, we underestimate it and we don't talk much about kidneys. It's always the heart, the diabetes, the hypertension stuff, isn't it?
Very well, very well. Kidney is basically a silent disorder, madam. Why? Because kidney is like a cell phone. Kidneys don't manifest any symptoms until 90% of kidney reserve has been lost. There's a reason why people don't recognize and realize the impact of kidney failure.
I think you've rightly mentioned, sir, that kidney disease is a silent disease. Why do you think it is silent and when do you think it gives us some alarming signs?
Kidney disease is prima facie a silent disorder because God has given lot of kidney reserve. A person can survive with only 5% of kidney functions. That's the reason kidney disorders don't manifest any symptoms until 90% of kidney function has been lost. Because by nature, kidneys are so robust, so powerful organs, that's the reason we are going to miss the kidney disorders. Among all the organs, kidney plays a totally different ball game. It looks at multiple organ functions. It will take care of not only excretory system, it will help in bone production, it will help in blood production. The kidney health is very much important for the health of the heart and the brain also. Still, kidney symptoms don't appear until 90% of kidney function has been lost because kidneys are such powerful reserve organs.
So, what are some subtle signs do you think that the kidneys would be wanting to us or to the body, okay, cool down, take it slow, you need to give me some attention?
The first and foremost symptom of kidney disease is absence of symptoms. It's only the high degree of suspicion what an individual has to exercise. But still, the first and foremost symptom is presence of small amount of swellings in the ankles or presence of swellings across the eyelids, periorbital purphiness, early in the morning. These are the first important markers which state that a person might be having some kidney disorder. And the second most important clue towards kidney disease is presence of hypertension, high blood pressure at a very young age. And third important symptom being presence of foam in the urine. Because foam in the urine in excess quantities signals that the person might be leaking protein in the urine. And fourth important symptom is presence of cola colored urine. It's not the red colored urine but the cola colored urine that indicates that something is happening in the kidneys. And the fourth important symptom being breathing problem. A person who wakes up at night and sits and feels comfortable, once again goes back to bed and feels breathless, that indicates that his lungs are getting accumulated with water. The signals either kidney disease or heart disease. And the last most important symptom is any person who is having intractable vomitings. That means vomitings lasting for days together, weeks together, and then complete lack of appetite, please check the kidney functions. In simple words, kidney is a subtle organ. It leaves subtle symptoms. Symptoms are most often indirect. Lack of symptoms is the most important symptom.
That's very well explained, doctor. So I like this point. Some people getting interrogated for the kidney symptoms because most of the kidney diseases are silent, as you mentioned. So, what are some simple tests that we usually do to screen these disorders?
People presume that kidney health is a very laborious process. No, there are only basic investigations which are important for assessing the kidney health. And one such test is spot urine albumin creatinine ratio. It's a simple test, can be performed at any point of the day. It's a test available which is readily available everywhere. Almost every diabetic can protect their kidneys because for diabetics, this particular test will be positive almost 6 years before their creatinine increases.
That's a long period.
Long
It's your
period.
alarm sign, yes.
That is known as rightly said, UACR, urine albumin creatinine ratio, is a wonderful underutilized investigation which can really mitigate the chances of kidney failure in diabetics. Because if a person can recognize kidney disease at the stage of abnormal UACR, his kidneys can be very well protected in this modern era. And second most important test being complete urine examination. My professor used to say that complete urine examination is poor man's renal biopsy. By doing complete urine examination, a person can have overall assessment regarding his urine quality, which is nothing but a surrogate marker of kidney health. And third most important test is serum creatinine. Serum creatinine or EGFR. EGFR is a test which is based on serum creatinine. By performing either serum creatinine and EGFR, a person can assess his kidney health.
So, are there any specific groups or special group people who should get these done on a regular basis or even at an early stage much before?
Wonderful. Again, a very high priority question you have asked. There are few sets of people who need to be interrogated and investigated for kidney health. And first most important is diabetics. All across the world, in India, in Telangana, in Hyderabad, the leading cause of kidney failure is diabetes. Therefore, diabetics need to be very much cautious about kidney health. And second group of people is hypertensives, the so-called people with high blood pressure. A person who is having long-standing hypertension which is poorly controlled, once again is high risk of kidney disease. And third important group is people who are having history of long-term uses of painkillers. Of course, all of us are supposed to use painkillers at one point of time. 1 or 2 days is okay, but a person who has been habituated for indiscriminate use of painkillers for months together, for example, a person who is having knee pains has been using diclofenac for months together, years together, please, they need to check for kidney functions. And more importantly, people who are having family history of kidney disease has to be screened for kidney health every year. And fifth important group is any person above the age of 50 years, blindly trust me, check your kidney functions with the help of spot urine albumin creatinine ratio, CUE, creatinine at least once in a year.
So you bring in another interesting topic. You spoke about painkillers, so that gets me to high protein diet. Do you think that has an effect on overall kidney function?
Obviously, that is the mantra of the day being high protein diet. But nature runs on one ultimate policy. The policy is nature respects balanced diet. A person has to consume balanced diet. As long as you consume up to 1 gram per kg per day, your kidneys are safe. If a person who is having good kidney health, if he can consume up to 1 gram per kg per day, that means a person of 60 kgs, if at all he is consuming 60 kg protein per day, safe. The problem comes when they abuse the protein. Abuse the protein to the extent that if a person start taking more than 2 grams per kg per day, therefore, the safest limit is accept up to 1 gram per kg per day of protein per day, up to 1.5 in athletics or in those people who are gym goers, okay. But be cautious about more than 2 grams per kg per day.
So balance and moderation is the key, irrespective of your kidney status.
Perfectly. I rightly said it's a balance and a moderation.
So another important point is lifestyle habits. I'm sure your lifestyle modifications, they would hit you in some way the other. So what are some healthy lifestyle modifications that you would recommend for be it kidney or overall well-being?
The lifestyle measures for proper kidney health being, there are three, madam. Number one is at least try to have a balanced diet. Never ever abuse your protein. Respect the ultimate balance which nature embarks upon, having balanced diet. Second thing is 150 minutes of physical activity per week. People always say that for everything we are going to link up to physical activity, but the life's beauty is going to lie in physical activity. Any person who is going to embark upon 150 minutes of physical activity per day is going to take care of every organ system, and the same applies to kidney also. And third important lifestyle measure is avoid anything which is white in color. That means avoid maida, avoid excess amount of refined sugar, and avoid excess salt. As long as you could avoid these three white substances, not only your kidneys, your brain is also going to be healthy, your heart is also going to be healthy, and your metabolism is also going to be in control.
So if you think kidneys could speak to us, what do you think they would be telling us?
They scream about only three things. One thing is respect your diabetes, screen your diabetes. The second message is respect your blood pressure. Kidneys have very sensitive filters known as nephrons. Each kidney has got almost 1 million nephrons. So both kidneys put together have 2 million sensitive filters known as nephrons. But these nephrons are so sensitive that the damage starts if the upper BP is persistently more than 130.
Do you think kidney damage is reversible once detected at a certain stage?
Obviously, kidney is like a motor. A motor can be damaged because of temporary factors. A motor can be damaged because of permanent factors. 40% of kidney disorders are because of temporary reasons. If a person is having temporary kidney disease, it can be very well completely can be nullified and reversed. If a person is having permanent kidney disease, then once again, still we have a silver lining. The silver lining is we can slow down the disease.
I think the world is moving towards preventive medicine, isn't it? So, what are some silent habits that you have consciously picked up over the years?
One thing is, the most disturbing fact is that under the name of good health, nowadays people are consuming excess amount of pink salt. But what people are missing is, it can be black salt, pink salt or white salt, the sodium content is the same. So just because one is consuming the pink salt doesn't mean that they are going to imbibe good health. So whatever amount of salt you are using, please take it in moderate quantity, less than 5 grams.
Another thing is some purifying things for the kidney.
Understood. Once again, you brought a very good point. That's when the so-called kidney flushers or detoxifying agents. Let me say one thing. Kidney are such robust, powerful organs. Kidney has given such a powerful blood supply that these kidneys don't require any further external deterging agents to flush it. The human body has been programmed that kidneys are flushed for thousands of times every day. Just give it good blood supply. The only purpose is give blood supply. So how we are going to give good blood supply to your kidneys? One thing, decrease the salt, take care of your sugars, take care of your BP. The kidney is going to enjoy its own luxurious blood supply and going to have the auto flushing.
I think people should start executing and follow all these beautiful points what you've mentioned, Doctor. And finally, if someone is listening to this podcast or watching you, what is that message that you would like to share with them?
The ultimate message is kidneys are silent organs. Kidneys are very powerful organs. Barring brain, there is no other organ in the human body which can do such meticulous multitasking. So respect your kidneys, protect your kidneys. Kidney health requires only simple measures. Simple measures are screening for diabetes, screening for hypertension, annually get checked for your UACR, urine albumin creatinine ratio, complete urine examination and serum creatinine, and don't use too much amount of excessive deliberate use of painkillers.
So thank you, Doctor, for such an informative session, and it was pleasure talking with you. Thank you so much.
My pleasure, madam. Thank you so much.